about how many women in the US have PCOS and how much of it is misdiagnosed or undiagnosed?
Yeah, so exact numbers, we estimate that about 10 to 15% of women have PCOS.
Okay.
That's a good question as far as how many are undiagnosed. I know I've seen stats, but I can't pull one right now. I'll
Yeah.
have to get back to you on that one. But it is true. A lot of us don't get diagnosed properly, or we just never really understand the connection. Like we might get diagnosed with insulin resistance, and maybe we have
Yeah.
had an irregular period our whole life. Maybe we've never really had an ultrasound. So we may not
Yeah.
know that we actually have this diagnosis and this, issue lurking in the background. So it's very common.
Eventually a woman inevitably goes to the doctor, right?
Right.
And so when you go into the doctor, just kind of standard typical doctor, what do they usually do for PCOS, and what does the journey to even get a PCOS diagnosis look like?
Yeah. Yeah, it can be a long journey for some of us. I would say
Yeah.
not as long as something like endometriosis for sure, but
Mhm.
it can be a whole process and a journey. There's a lot of resistance with wanting to run certain labs that can be really
Yeah.
helpful at determining PCOS actually is at play and also
Mhm.
helping to illuminate what symptoms might be or the cause behind certain symptoms. But I
Yeah.
would say the typical treatment protocol for women with PCOS, the number one is birth control. That's the
Right.
number one because that can help to kind of, shut down the function of our ovaries in a certain capacity and control for symptoms like irregular periods and facial hair and some of those
Mhm.
more androgen driven symptoms. Metformin is also probably the most
Mhm.
common treatment as well. Even if somebody doesn't have insulin resistance, a doctor will very readily prescribe metformin just to see if it helps. And it can be helpful
Yeah.
for sure. But those are probably the two most common. Yeah.
Okay. And
Hmm.
then, so then your practice, right? So
Yeah.
you're meeting a lot of women probably right when they find out that they have this. Is that right? They're finding your
Yeah.
work and reaching out to you?
Yeah. A very common scenario too is when a woman has been on birth control since maybe the age of 13 or 14
Yeah.
and they're in their early 30s now and they're ready to start a family. They come
Yeah.
off birth control, they never get their period back and they don't understand what's
Oh,
going on. And what's happened is it wasn't caused by the birth control, but it's birth control has kind of been covering up the issue. So they
yeah.
have no tools, no understanding of like what's happening, no idea how to
Yeah.
go about getting their cycles back and starting to ovulate on their own and get pregnant outside of, maybe their doctor's like, oh, no period. All right, IVF. And
Yeah.
the reality is they can't, they don't have to necessarily go that route. We can work
Yeah.
on ovulation restoration outside of that.
Right. How is PCOS impacting fertility?
Yeah, so PCOS is the leading cause of infertility
Mhm.
worldwide. The reason being because many of us are not ovulating consistently or at
Mhm.
all. So, and I'm going to backtrack too, because again, we don't learn enough about ovulation and the
That's
importance.
right.
Ovulation is
Yeah.
important even outside of even thinking about fertility. It's
That's
the
right.
only time, yeah, it's the only time in our cycle our body is producing ample what's called progesterone. And
Yeah.
progesterone balances out estrogen in the body. We don't want an overload of estrogen and no progesterone to kind of back it up. They're kind of like yin and yang. In the fertility sort of space, ovulation is when your body releases a mature egg. That egg is the one that can potentially be fertilized. And so when we're not ovulating, we're not releasing that egg, and there's zero chance for a natural pregnancy if we're not releasing that egg and potentially having it fertilized.
And I think another good trend or tailwind that we have right now within the health and wellness movement is that a lot of women are going and getting more testing, right? And there's a lot
Mm,
of access to testing outside of just going to your,
yeah.
general practitioner and saying, I need these tests, which to your point earlier, sometimes they're reluctant to run or it's kind of an uphill battle to get it run.
Yeah.
Meanwhile, you have women kind of on ChatGPT or whatever it is, right? Asking what tests do I need run? What levels do I need checked for X, Y, or
Right.
Z? And it's
Right.
spitting out this whole thing, right? So they're
Right.
going in with kind of like, hey, this is what I want done. So again,
Yes.
I think all of this is good because it's more and more awareness, but there is this kind of friction pinpoint of where can I get these tests run? What does my
Yes.
insurance cover, right? All of these
Right.
things. Would love to just hear your perspective of testing and then also what tests you think are necessary and the most helpful for a woman who may be just trying to figure out, do I have PCOS or not because I'm struggling with
Yeah.
infertility?
Yes, yeah. Thank you for bringing that up. I was just talking to colleagues about this. I've actually been really diving more into the lab
Mhm.
work, blood work, testing, all kinds of testing sort of world because, yeah, it is becoming apparent to me. It's always been apparent, but how lacking this is, when we
Yeah.
go to, it's like our standard primary care or OBGYN, um, yeah, we can get some labs run, but most of the time we don't get the full thing. We don't get the full
Yep.
panel of what, I would recommend. So I have a huge list. I'm not going to go through absolutely
Yeah.
everything that I would love
Yeah.
to see because there's just so much, but I
Yeah.
would always want to start with a full hormone panel. And typically that
Mhm.
can include estrogen. It includes
Mhm.
progesterone. And yes, we do want to test progesterone 7 to 10 days after confirmed ovulation
Mhm.
because one of the main things that I hear is, oh, my progesterone's low. That's why I can't conceive. My doctor said my
Yeah.
progesterone's low. And I ask always, when did your doctor test your progesterone? Well, cycle
Yeah.
day, 21. Well,
Yeah.
when did you last get a period? Oh, back in April 2024.
Yeah.
So
Yeah.
we're not testing at the right time. The majority of us actually can produce progesterone just fine. We're not ovulating to actually get there. So
Yeah.
that's our issue. So progesterone needs to be checked at the right time. And that would include also testosterone. That's a
Mhm.
huge one. I want to see what testosterone levels are looking like, very commonly elevated in PCOS. I would also love to test DHEAS. It's another
Mhm.
androgen, but it's produced primarily in our adrenal glands. So it
Mhm.
has a huge connection to stress. And
Yeah.
a lot of us with PCOS have this adrenal dysfunction happening
Mhm.
also. And that can contribute to so many symptoms like fatigue. And it actually, DHEAS can contribute to elevated androgen symptoms just like testosterone. So if
Yeah.
somebody's testosterone is looking normal and they're experiencing, something like facial hair, body hair, acne, irregular periods, it could be actually due to that. So that's another thing to check. I also like to test what's called sex hormone binding globulin or SHBG. That's
Mhm.
commonly not tested, but when it's low, it can actually make a normal testosterone level act more aggressive. So if someone's saying to me, I had my testosterone checked and it's normal, but I'm
Yeah.
growing a beard. What's going on,
Yeah.
Cory? I can say, let's look at your SHBG. 9 times out of 10, that's low. And we can work
Mhm.
to raise that. So that's one that isn't commonly tested. And I would love to see that checked more in women with PCOS. I love to look at vitamin D,
Yeah.
chronically low in women with
I was gonna
PCOS,
ask, that was my
chronically
next
low.
question. Yeah.
Yes,
Okay.
yeah, that's a huge one, and it can contribute to irregular periods,
Yep.
hair loss, even mood swings. It's a big one. So that's huge. Another one that I love to check is cortisol. I love to see what's going on
Mhm.
there. There's different ways and different schools of thought around how to check and when to check that one. I love to check a thyroid panel, full thyroid panel, to
Mhm.
see if that's concurrent because it's common to have both a thyroid issue and PCOS. So
Mhm.
love to see what's going on there. I love to check iron and B12, especially if someone's
Mhm.
having energy level and fatigue issues. That's very typical for me to include. And I love to check outside of those, I love to check liver enzymes. Fatty liver, non alcoholic fatty liver disease is
Yep.
very common in PCOS. We're at a much higher risk. So I'd love to see what ALT and AST are doing and go from there. I love to check a full lipid panel. I love to see what
Mm.
your LDL, is doing, your triglycerides, very common to have elevated cholesterol. And these are things that if we're testing for early, we can
Yeah.
catch, but it's just common to say, oh, you're 25, maybe your BMI is 26. We're not going to,
Yeah.
we're going to bypass that, but we can check and potentially prevent so many things just through early testing.